Good evening, good evening, good evening, good evening, and welcome to Health Talk. Yes, it's been a minute since we've been on, but we're here and we've got some things we want to share with you today. And I'm glad that you decided to take a few minutes of your time to come on in and share with us what we have to present to you today. Thank you again for taking a brief moment out of your busy schedule to come and chat with us and to talk with us today and share with us. I promise you, we're not going to hold you long. I just want to bring a little brief update on some things. And the thing I want to talk about is the current measles activity that is taking place within the United States. Yes, there is an issue going on in the United States when it comes to measles, and we need to have a discussion about it. So, the ongoing outbreak and case counts. Now, within South Carolina, we're going to talk about the South Carolina outbreak. South Carolina health officials are reporting that 124 new measles cases since January 13th, 2026, and it is now January the 16th, 2026. So in the last 3 days, there have been 124 new documented cases of measles in the state of South Carolina. And that brings a total of 558 confirmed cases, mostly in the upstate of South Carolina, where the outbreak is centered around the Spartanburg region or area, and that many schools and public settings have identified exposure, and hundreds are in quarantine or isolation. We need to talk about this. All right. Now, in the Smolensk County of Washington, a new local outbreak was declared after 3 measles cases in unvaccinated children tied to exposure from a family visiting from South Carolina. This is an early sign of local transmission in the Pacific Northwest. In the state of North Carolina, the state now has at least 7 measles cases linked to the outbreak that is occurring in South Carolina, mostly among unvaccinated siblings. So, travel-related exposure, a confirmed measles case involving a young child who traveled through Mid-Atlantic Transportation Hub, the Philadelphia Airport Amtrak station, has promoted regional exposure notification. Now, according to the CDC officials, measles data page that was updated on January the 14th, 2026, there are 171 confirmed measles cases have been reported so far in 2026 across 9 U.S. jurisdictions, and that includes Arizona, Florida, Georgia, North Carolina, Oregon, South Carolina, Utah, and Virginia. Nearly all of these are tied to ongoing outbreak that began in 2025. All right. So for full 2025 U.S. total, the CDC reported 2,242 confirmed cases with 49 separate outbreaks documented, the highest number in decades. Now let's talk globally. Measles is also resurging globally, particularly where immunization coverage has lagged. That's very important for us to understand that. The American region, including Canada and the United States, lost its measles elimination status in 2025 after sustained transmission across multiple countries. These are outbreaks. They're ongoing in many parts of the world, and even fully vaccinated travelers can contribute to the spread of measles in under vaccinated communities abroad. So, what's driving the outbreak? Some of the things that are driving the outbreak includes lower vaccination coverage, a decline in the MMR, measles, mumps, and rubella vaccine uptake among children are strongly linked to measles resurgence and sustained transmission. So what are we saying is the lack of immunization. Basically, it's what's driving this insurgent or resurgent of the measles. Highly contagious nature. Measles spread extremely easily. Their airborne transmission can occur via aerosolized virus lingering in the air for up to 2 hours. In other words, a person that has the measles virus and cough, sneeze, what have you, that transmission remains in the air or linger in the air for up to 2 hours. And if someone who is unvaccinated happen to come into the area within that 2 hour window, it increases their likelihood and possibility of contracting the measles virus, therefore taking it to other areas, other territories, especially as we said earlier, in those regions and area where unvaccinated population is high. Also, travel related importation and community spread. International and domestic travel continues to seed new cases, as I said, in under immunized communities. So here are some public health and prevention notes. Measles elimination status. The United States and Canada had previously achieved measles elimination. That is important for us to hear and to understand. The United States and Canada had previously achieved measles elimination, but recent widespread outbreaks have put that status at risk and have even reversed it. Vaccination. The MMR vaccine, measles, mumps, and rubella, the 2 doses, remains the most effective protection. The MMR vaccine, 2 doses, remains the most effective protection against the measles virus. About 97% effective at preventing measles infection. 97% effective. Exposure notification. Local health departments are issuing timely guidance and exposure notification when cases are linked to public venues such as airports and trains, of those things of those nature. Vaccine schedule changes. Federal decisions around revamping the childhood immunization schedule have been in the news. However, guidance still strongly support timely MMR vaccination. MMR, measles, mumps, and rubella. So what are some of the symptoms you want to watch for? And I'm glad you asked, and thank you for asking. Some of the symptoms you want to watch for are a typical appear 7 to 21 days after exposure. So the symptoms typically appear 7 to 21 days after exposure. In other words, 1 to 3 weeks after exposure. And these symptoms include things such as high fever, cough, runny nose and red eyes, a characteristic red rash. Vaccination is strongly influencing risk and severity. The lack of immunization. So I just want to come on, give you a little brief update regarding the current situation of the measles outbreak. And as I said before, that in the United States and Canada, that we had previously achieved measles elimination. There were no measles. There was no measles cases. But now, due to current changes in the status of vaccines, the discussion, about revamping the schedule for childhood immunization, especially with the MMR, these things have contributed to a resurgence and now currently an outbreak of the measles viruses. And I want to name those areas again where there are 171 confirmed measles cases as updated by the CDC official measles data page. As of January the 14th, 2026, 171 confirmed measles cases have been reported so far in 2026. This is just 2026 across 9 USA districts. And again, those 9 USA district jurisdiction includes Arizona, Florida, Georgia, North Carolina, Ohio, Oregon, South Carolina, Utah, and Virginia. These are the 9 U.S. jurisdictions that have confirmed reported cases of measles as of 2026. That's a lot of cases. Some of you say, well, no, that's not really a lot of cases. But it's a lot of cases when you go from having zero, not, zip, nana, nook. You go from 0 cases to 171 cases as of January the 14th, 2026. This is the first month of 2026, and we now have 171 confirmed cases across 9 jurisdictions. And as I said earlier, in the state of South Carolina, as of January the 13th, 3 days ago, this is just one state, there were reported 124 new cases. I guess you're saying the math is not adding up. It is. It is. Specifically in the state of South Carolina, 124 new measles cases since January 13, 2026. And that brings a total measles cases in the state of South Carolina, 558 confirmed cases. That's part of the outbreak that is occurring, and it's mostly in the upstate of South Carolina, particularly around the Spartanburg County region. And that 171 that I talked about was a nationwide trend, okay? The other one I just finished talking about was specifically to the South Carolina area. All right, and globally, as I said, in the United States and Canada, we had eliminated and eradicated or measles, but due to recent changes in policies and what have you, we are now seeing a resurgence and an outbreak of the measles vaccine. It is your right, it is your decision, whether you choose to become or to receive the vaccination or have your child to become immunized. That is your right, that is your responsibility. But it is my responsibility as a public health practitioner to provide you with evidence-based scientific information to help you to make an informed decision for you, your child, your family, and your neighbors. And that is simply what I'm here tonight doing, is providing you with scientific proof, scientific research, evidence-based information and data so that you can make an informed decision regarding the health and well-being of your family, your children, your neighbors, and anyone that you may be in contact with or come in contact with, or your children may come in contact with. I'm here to provide you with this information so that you can make that informed decision. I'm not here to tell you what to do, but I'm here just to provide you with the information so that you can make that informed decision. I hope this information has been beneficial to you and that you found it useful. Listen, if you're not following us on our Health Talk Facebook page, please head over there and go ahead and follow us. And if you're not subscribed to our YouTube Health Talk channel, please, it helps us out a lot if you'll go over there and subscribe to our Health Talk YouTube channel. And make sure you hit that like, subscribe, hit that bell button so you can get notification when we upload new material or when we come on live. Again, tonight, we just wanted to bring you some information about the current measles activities that is taking place in the United States of America. Again, I hope you have found this information to be very beneficial in helping you and your family to make an informed decision regarding vaccines and vaccination, immunization. Very, very, very important that you make an informed decision. I'm just providing you the tools to do that. All right. You have been listening to Health Talk. I am Dr. Ferris Corbett. Health Talk is a part of He Cares Training and Education Center, LLC, where yours truly is the